Today we are on day 4 of our staff vaccination programme. So far we've had about 1,500 of our colleagues come through the door to be vaccinated, frontline staff, and it's absolutely fantastic to be able to do that for them because we've all collectively had a miserable 10 months because of COVID, and this vaccine offers us a really important opportunity to see perhaps a brighter future for the next year.
Spent the whole of last week and the whole of the last couple of weeks actually teaching the peer-to-peer vaccinators, and then this week I actually get to have a go myself at vaccinating members of our own staff. The responses have been really positive from all the members of staff. They've actually been really keen to actually get the vaccination.
I've come down here today to get the vaccine, so came in, went through the procedures of checking if I've had symptoms or a vaccine or test previously, and then came on through to the tent, gave my name, etc. And then whipped on through and had it done. I feel really lucky actually. I've only been in the trust since the end of September, and I feel privileged to be one of the early ones to be getting it.
I feel amazing actually. I'm not a big fan of needles, but everyone was so good, so professional. I feel on top of the world right now. It's amazing.
It's quite emotional really. I think this is a significant point in the fight against COVID, so quite a lot of emotions for me personally. I worked on our COVID cohort ward at the beginning of the year for the first wave, so I have been very patient-facing with patients who've had COVID, so incredibly emotional. The Trust are doing an amazing job. It's very well organised. I didn't have to wait, I was looked after, I've been cared for, and I've actually seen some of my colleagues today who I haven't seen in months, so that again has been lovely to see them. Yeah.
Well, my name is Jean Hart and I'm a volunteer for the NHS Trust, the Humber Trust, and I've come here today to help them with the work delivering the jabs. It's life-saving stuff, isn't it? And they deserve all the support they can get. This is more than clapping hands or hitting a spoon on a pan outside the house. This is something very tangible.
There are some people who are very nervous when they're coming through. There's some people who haven't seen people out of their homes because they've been shielding for various reasons. So it's their first bit of human contact. People are just really grateful because it's that little glimmer of hope, isn't it?
I'm here today because I'm one of the peer vaccinators, and it's been a real privilege. I've been here Tuesday, Wednesday, and I'm here today, Friday and Saturday, and I'm on annual leave, so it's been a really good use of my time. I think it's part of the year that we've had, it's the pressure that people have been under, it's the impact that it's had on patients, it's the staff, and it's been part of a solution to a really big problem that we've had to deal with all year long, and if I can play a small part towards making a better life for us all for 2021, then I'm going to be part of that.
We are doing the reconstitution of the Pfizer vaccine today, and it's a very delicate molecule, so it needs to be done very carefully so that we don't spoil the vaccine. And staff here are all trained to do it as per manufacturer's instructions. So every step of the process is checked carefully. So we want to make sure that we measure the correct amount of normal saline and then we mix it in the correct way. So every single step is checked, and the pharmacist and technician work together as a team. Everyone involved here has felt really positive about the whole experience. This is our only hope to bring this terrible pandemic to an end. And it's been, shall I say, it's been good fun to be involved in the process. I know it's a serious process, but it's been really good to be involved, and it's good to feel part of a very positive team to bring this whole terrible pandemic to an end.
The experience that we're getting today is just fantastic. The people that I'm working with, although we work in the same organisation, we're coming from all different walks of life. I work in psychiatry, I manage a male hospital for adults with mental health problems. In there I've got people from school nursing, from health visiting, I've got people from community services, all coming in together, and the sense of camaraderie is something that I haven't experienced in this organisation, well, ever. It's just brilliant. You've all got a smile. The people that we've got coming in, you know, we've got everybody from doctors to cleaners, all talking to each other, socially distanced, but actually it's a bit of a sense of occasion, and we know that every jab that goes into an arm actually looks at protecting the public, but more importantly as well, it protects my patients and it protects my staff so that we can continue to meet the needs of the public and for the next year.
Brilliant. I feel liberated. I feel like it's a sign of optimism and hope for the future, that we're moving forward, that this is the beginning of that journey for a lot of us. I feel absolutely proud as punch to be part of this organisation, the way that this has been set up, and the fact that, you know, we didn't know, we didn't think, we didn't anticipate that we would be getting the injection as quickly as we have done, and in such a sort of like just brilliant sort of organised. Really felt safe, really felt confident. The staff were brilliant. I just feel really upbeat. It's good.
This week has been a good week to be a nurse. Couldn't be prouder.